I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to give an update to several previous videos that I've uploaded that go into detail about my journey thus far after being diagnosed with vaginal atrophy and being put on Vagifem as my course of treatment, which worked wonderfully, by the way. And then about 8 months later, after being on the Vagifem, I started to notice some postmenopausal discharge that first had kind of like a grayish blackish color to it until eventually turning a light brown, which it's continued to be to this day as I am still experiencing that discharge. And then I was also starting to feel a little bit of pain and discomfort in the left side of my lower abdomen that felt like it was coming from my left ovary. As I've said in my previous videos, I have had a plethora of different tests done trying to figure out what's causing this pain and this discharge, including a CT scan that was done in the emergency room that did not show any abnormalities. I've also had a colonoscopy, an upper GI, which is the scope they put down your throat in order to look at your stomach, and then also a HIDA scan, which tests the function of your gallbladder, done through my gastroenterologist, with all of those tests coming back normal as well. And then I've had a pelvic exam done through my gynecologist, and also a procedure called a sonohysterogram, which is where they insert a tube up through the vagina, fill the uterus up with a saline solution so that they can get a good look inside of there, just to make sure that there's no masses or tumors, since any type of postmenopausal discharge or spotting always needs to be investigated for the possibility of either uterine or endometrial cancer. And then he also took a biopsy of my endometrial lining as well, both of which came back normal, although it did show that I have 3 small fibroid tumors on my uterus that my gynecologist isn't the least bit concerned about. I also had a CA-125 blood test done, which is a cancer marker to test for ovarian cancer, which came back normal. And then I also had my first vaginal ultrasound done during that time as well, which did show that I have a simple cyst on my left ovary that measured 9 millimeter by 9 millimeter, so just under 1 centimeter, which in a sense kind of gave me a little bit of comfort, since I had told everybody, the ER doctor, my gastroenterologist, and my gynecologist, that I really felt like whatever this pain was, that it was coming from my left ovary. But they all told me, since I have been postmenopausal for about 6 years, it's very rare for a postmenopausal woman to even have any type of ovarian cysts. And so they all kind of felt like either it was in my head, or that the pain felt like it was in that area, but it was actually coming from someplace else, which is why I had all these different tests done in the first place. But considering they all came back normal, and now to learn that I did have a cyst on my ovary, even though they said it was very uncommon, I had to believe that that had to be at least in part of what was causing the pain that I was feeling. And so because the cyst did not meet the criteria for being cancerous, it was under 4 centimeters, it was fluid filled, perfectly round, didn't have any blood supply going to it, and it didn't have any shadowing, meaning that the ultrasound didn't pick up any solid components to it. My gynecologist felt comfortable taking the wait and see approach, and to have me come back in 6 weeks to have the ultrasound repeated again, just to see if it changed in size at all. I did go back in 6 weeks later to have that ultrasound repeated, and this time the ultrasound tech said that it was measuring 6 millimeter by 6 millimeter, so 3 millimeters smaller, which was a good thing. But then she also mentioned that I had something on the outside of my left ovary as well, that if I was of ovulating age, so in other words wasn't postmenopausal and still ovulating, they wouldn't even call it a cyst, but would rather call it a ruptured follicle, meaning that the egg ruptured out of the follicle during ovulation, and that's what caused that spot. But obviously, being postmenopausal and no longer ovulating, she couldn't definitively 100% say what exactly it was. So after getting dressed and getting to go in to see my gynecologist, of course I brought this up to him. He wanted to see the ultrasound for himself, came back in and said that it actually was on the first report, but for some reason the ultrasound tech never told him about it, or he never saw anything about it, but that it was the same size now that it was then, and that he wasn't really, that concerned about it, considering it was small, it didn't have any free fluid around it, and it didn't have any blood supply going to it. But unless he did a biopsy of it, he couldn't 100% definitively say what exactly it was. So at that point, he told me I had really 3 options that I could choose from. Either I could go ahead and have surgery to have both of my ovaries and fallopian tubes removed. That way he could send whatever that was out for a biopsy, just to make sure that it wasn't cancer. or I could go ahead and set up surgery for at least 6 weeks later so that I could go back in and have my third ultrasound done just to see whether or not that spot has changed. Or I can opt not to have surgery at all, continue to take the wait and see approach, and come back in anywhere from every 6, 8, or even 10 weeks to have that ultrasound repeated just to keep an eye on it. He did give me some brochures to go home and read that talked about the surgery, all the risks that are associated with it, and told me to go home and think about it, which I did a little bit of research on it. And so my final decision at that time was that I was going to go ahead and set the surgery up for at least 6 weeks later so that I could go back in, have my third ultrasound done, and just see if it changed, just so I knew if I was going to be making the right decision. Obviously, that's a big deal to have both of your ovaries and fallopian tubes removed, and even though being postmenopausal, those ovaries aren't really serving any purpose at this point, they do still secrete small amounts of estrogen, which help to fight osteoporosis and heart disease. And so if I don't have to have them removed, I'd rather not. And so, I did talk to the doctor about that, and he said he was fine with that. Ended up getting a call about 2 weeks later that the surgery was going to be on May 30th. And then I just went in last week to have that third ultrasound done, which is why I am now doing this update video. So this time, the first cyst has continued to stay stable at right around 6 millimeters. So it hasn't really changed in size since the previous ultrasound that was done. And then that spot on the outside of my ovary has continued to stay the same size as well. I did ask my doctor this time because I really wanted to have all of the information that I could in order to make the decision of whether I was going to keep that May 30th appointment to have the ovaries removed, reschedule it, or just cancel it altogether. I wanted to know exactly what the report said about that spot on the outside of my ovary. So he read it, and it called it a simple cyst that measured, it was something like 3.68 millimeters, so and right in between 3 and 4 millimeters, and that it had a hyperechoic rim to it. Never hearing of the word hyperechoic rim before, I asked him what exactly that meant, and he said, so basically you have this very small cyst that has fluid in the middle of it, and then it has a ring on the outside of it that's solid. So that means when the ultrasound was being performed, the ultrasound picked up some type of solid matter that caused it to look like a darker ring on the outside of that cyst. I asked, okay, well, what exactly is that then? And he said it could be blood, it could be fat, it could be scar tissue, or it could be a tumor. I asked what the chances were of it perhaps being a tumor, and he said again, it really didn't meet the criteria considering it was extremely small, didn't have any free fluid, didn't have any blood supply going to it. But that doesn't mean that it's not the beginning of cancer and that we've just caught it really early. I then asked him if I were his daughter, his wife, his mother, would he recommend that I go ahead and have the surgery, keep that May 30th date and have the surgery to have my ovaries removed? Or would he feel comfortable with me perhaps putting it off until the end of summer to give me a little bit more time to do a little bit more research on it, mentally prepare myself to have the surgery, and feel like I'm making the right decision? Because at this point, I just feel like I'm not ready to have the surgery yet. Like mentally, I'm not ready to have the surgery yet. So he said, considering, that my CA 125 blood level came back normal, that this is staying the same size. This is now the third ultrasound where this thing on the outside of my ovary has not grown in the slightest little bit. It does not meet the criteria to be a cancerous mass. So at this point, he said, I do feel comfortable with you going ahead and keeping that wait and see approach. He said this time I would recommend you coming in either 8 to 10 weeks to have it done again rather than 6, just to give yourself a little bit more time. And then you can decide from there. But at this point, he said that he felt perfectly fine with me going ahead and putting the surgery off to give myself a little bit more time to decide whether or not that's the route I wanted to take. And so that's what I'm going to do. I made another appointment to have an ultrasound done in 8 weeks this time, so right in between that 6 and 10 week mark. And if it hasn't changed, I will cross that bridge when I get to it. I do think that come the end of summer, I will probably go ahead and have the surgery to have my ovaries and fallopian tubes removed, only because if this is cancer, then obviously the last thing I want to do is get to the point where it can get big enough that it is going to spread, since ovarian cancer can be quite an ugly cancer. And so I'd rather get my ovaries removed before that happens. And so, I definitely do think by the end of summer I will be ready to have that surgery. But in the meantime, at least I can have maybe 1 or 2 more ultrasounds just to see what's going on with it, so that mentally I can say to myself, okay, yes, now's the time. He did also say to me, because I am experiencing that pain, and although in the beginning he kept trying to say that he didn't think that it was coming from the ovary, now he's kind of agreeing with me that, considering all my other tests came back normal, perhaps it really does have something to do with whatever this is on the outside of my ovary. He said, obviously you don't want to go the rest of your life feeling that pain either. And so not only is it a factor of not wanting it turned into cancer, but not wanting to live with the pain for the rest of your life. He said, so that's also something that you have to think about, and only you can decide what's going to be best for you. And so that's where I'm at in the process. I set up another appointment to have another ultrasound done in 8 weeks. I'll wait to see what happens from there, and then I think I'll go ahead and set the surgery up for the end of summer, beginning of fall. That way, I have a 13-year-old son who will be back in school, and I can kind of recover in peace, so I don't have to worry about what he's doing all day as I'm sleeping. And, again, just kind of prepare myself mentally that this is what I'm going to have to do. So just wanted to update everybody, let everybody know what was going on and what I decided. As always, if you have any questions or comments, please feel free to leave them. Other than that, I will be back with another update once I have that 4th ultrasound and go from there. Thank you so much for joining me, and I will look forward to seeing everybody again next time.